नमः पार्वती पतये गोविंद नाम संकीर्तनम्।
Today's topic is going to be Ayurveda for children. So this is all about today's topic. Ayurveda is a time-tested system. So Ayurveda is a system that helps to people achieve health and happiness. While it is important to achieve health and happiness, it is also important to stay relevant to the times we are living in. So Ayurveda is a science that has been written down by our Vedic Maharshis and Acharyas 5,000 years ago. So what was told 5,000 years ago should be adapted to the times we are living in today. In today's lecture, I'm going to talk about how Ayurveda looks at health of children, and I'm going to discuss a few of the common health problems commonly faced by children, and how Ayurveda can help the general welfare of children by promoting general health. And I'll be talking about the practice of Swarna Prashanam today, the Ayurvedic way of immunizing children. So these are the topics I'm going to discuss today. So I told you earlier that the five Mahabhutas, or the five great elements, these are responsible for making up the world, but these are responsible for making different kinds of matter. So in different permutations and combinations, the five Mahabhutas combine together and form the whole world. So when it comes to the living bodies of all living entities, the five Mahabhutas, Prithvi Mahabhuta or the earth element, Jala Mahabhuta or the water element, Agni Mahabhuta or the fire element, Vayu Mahabhuta or the air element, and Akasha Mahabhuta, which is the space element. So these are known as the five Mahabhutas. So they are directly responsible for the formation of the physical body of every living entity, and they are responsible for the developmental process of the body. So from a single-celled zygote to a 9-month-old baby, so a lot of changes take place in the development of the body. So in all of these processes, so we have the involvement of the five Mahabhutas. So in the classical Ayurvedic treatise known as Sushruta Samhita, Acharya says, Shukra Shonitam Garbhashayastham Atma Prakritivikara Sammurchitam Garbha Ityuchyate Tam Chetanavasthitam Vayur Vibhajati Teja Enam Pachati Apah Kledayanti Prithvi Samhanti Akasham Vivardhayanti, and so on. So here he says Shukra Shonitam. So Shukram Chatata, Shonitam Chatata. So this is the formation of the Shukram. So the male gamete or the sperm, Shonitam is the female gamete or the ovum. So a combination of Shukram and Shonitam. So the zygote which is formed by the fusion of the male and female gametes. So this is known as Shukra Shonitam. So this is how we interpret the word Shukra Shonitam. Shukram Chatatu, Shonitam Cha, Shukra Shonitam, and Garbhashayastham. So the word Garbhashaya means the female uterus. The word Stha means Garbhashaya Tishtati iti Garbhashaya. Something that is situated within the female uterus is Garbhashayastha. And then Atma Prakritivikara Sammurchitam. Atma is the Jivatma or the living soul, the soul which is the living entity. And then Prakriti Vikara, the word Samurchita means the combination. So when Atma unites with the Prakriti Vikara, the word Prakriti is the dull matter. So anything that is there in the material world, any dull matter that is there in the material world is Prakriti. Prakriti Vikara is anything that is a transformation of no, Prakriti is Prakriti Vikara. So Garbha is formed when the Prakriti Vikaras and Atma, the Jivatma, unite together. So it is at this time that only then it is known as a Garbha, it is only then it is known as a living entity. So Garbha ityuchyate, it is known as Garbha. So to be known as Garbha, it has to have these three lakshanas. It should be a Shukrashonitam, that is Sayukta Shukrashonitam. So it has to be fused Shukrashonitam. It has to be implanted within the female uterus. And then there has to be a fusion between the Jivatma and dull matter. Only when these three lakshanas are present, it is known as a viable Garbha or live Garbha. Garbha ityuchyate. So when ultrasound alarm potruppa, single viable intrauterine gestation. So that is known as Garbha. Single viable, something that has life is viable. Intrauterine is something that has that is there within the uterus. Intrauterine is Garbhashayastha. So when a woman is pregnant and ultrasound is taken, so this is how it is described. So a single viable intrauterine gestation. So gestation is pregnancy has begun. So only when these three lakshanas are there, it is known as a Garbha. Tam Chetanavasthitam. So that Garbha which is endowed with Chetana or consciousness. What do the five Mahabhutas do? How do the five Mahabhutas help in its developmental process? So here Acharya says, Vayuhu vibhajati. So any kind of cell division is controlled by Vata, Vayu Mahabhuta. And then Tejaha enam pachati. Pachati, literally the word pachati means to cook. So when we say Mata pachati in Sanskrit, it means mother is cooking food and no food in the kitchen. So it means mother cooks food. So when within the body, when we say paka occurs. So in the kitchen, when we say paka occurs, it says cooking is taking place. So within the physical body, when we say paka is taking place, it either means digestion is going on, or it means any kind of metabolic process is taking place within the body. So all metabolic processes are known as pakas. So pachati means when one entity performs the metabolizes something else, so that we call it as pachanam. So when one entity transforms something else, some other entity within the body, that then we say entity A pachati, the other entity B. So this is known as pachana kriya within the body. And then apaha kledayanti. So jalamaha bhuta imparts kleda bhava. So it imparts water to it. And then prithvi samhanti. Prithvi mahabhuta helps it to gain in a structural basis. Akasham vivardhayati. Akasha helps it to grow. So here, the five Mahabhutas, they don't work in the body directly. So it is there where the five, we have got the Pancha Mahabhutas within the body. So the Mahabhutas don't function directly as Mahabhutas themselves. So what they do is, the five Mahabhutas, they combine together to form the three doshas, Vata, Pitta, Kapha within the body. Prithvi Mahabhuta and Jala Mahabhuta form Kapha dosha within the body. Akasha Mahabhuta and Vayu Mahabhuta combine together to form Vata dosha within the body. And then Agni Mahabhuta and Jala Mahabhuta, these two combine together to form Pitta dosha within the body. So we have got 5 types of Vata, 5 types of Pitta, 5 types of Kapha within the body. All of these 15 subdoshas are formed when the five Mahabhutas combine together in different permutations and combinations. So the word Vayurvibhajati here is very, very important here. So among the five types of Vata, so it is a Vata named as Vyana Vata, which is responsible for cell divisions that take place within the body. So that is why in Charaka Samhita Acharya says, Vayuhu Sarva Sharira Dhatu Vyuhakaraha. So the word Dhatu means body systems of body tissues. Vyuha means proper divisions. So within the body we've got the dhatus of the cells of each dhatu are different. So Vyuha is differentiation. So each group of cells are different. So for example, epithelial cells are different, endothelial cells in our body are different, squamous epithelial cells are different. So we have got innumerable kinds of cells. So this is known as dhatu vyuha. So this dhatu vyuha, so this is something that is under the control of Vyanavata within the body. So during the time of Garbha formation, when Vyanavayu functions normally, so when there is no abnormality in its function, when all the dhatus upon which Vyanavayu acts, so when all of the dhatus are in normal state, a baby, born without any congenital abnormalities, some children are born with birth defects. So all of these will be absent when Vyanavayu, within the embryo functions properly. When the dhatus within the embryo and fetus function properly. So that is very, very important. So, when a baby is born, a 9-month-old baby is born, all the organs are well formed. So we call this as Vyakta Avastha in Sanskrit. The word Vyakta means anything that is manifest. The word Avyakta means anything that is unmanifest. So when we go to the single-celled zygote, so even just like how we have all the organs, so even the zygote has eyes, the zygote has ears, even the zygote has all the distinct, the bones. It has got muscles, so it has got intestines, lungs, and every single organ. So all of these is present, and all of these are present in the zygote in an avyakta form. Avyakta means unmanifest. So only when proper pachanam by Tejo Mahabhuta or Agni Mahabhuta takes place. So as a result of Agni Mahabhuta and Vayu Mahabhuta, all the transformative processes take place and a baby is born hale and healthy. So we see some children are born with birth defects like cleft lip and cleft palate. So they require a plastic reconstructive surgery to correct the disease. And there are some children who are born with congenital abnormalities in the heart. And there are many children who are born with chromosomal abnormalities. So there are children who are born with Down syndrome, Klimpfeller syndrome, and all that. So in all such cases, Vyanavata has not performed its function properly. It's as a result of this, Vyanavata, such children have such fate. So every time, every single day, we should be thankful to all the 5 pranas, that govern our all our physiological processes. So that is why, while doing pranagnihotam or parisheshanam, we say pranaya swaha, apanaya swaha, dhyanaya swaha, udanaya swaha, samanaya swaha, we say. It is because, all of it is because of the pancha pranas, the 5 pittas and 5 kaphas that, we remain healthy. So when there is even a small mistake in it, so some great disease condition or birth defect occurs. And then he says, Tejaha enam pachati. This is very, very important. So modern science says that every organ has its own group of cells from which it originates. So in the same way, when we go through Sushrita Samhita, No, while explaining the formation of organs, no, visceral organs like intestines and all, so he explains very beautifully. Asrujaha shleshmanaschapi yaprasada paromataha tampachyamanam pittena vayushchapyanudhavati tatosyantrani jayante udambastischa dehinaha, says Acharya in his Sushruta Samhita in Sharirasthanam. Asrujaha, the word asruka means blood. Asrujaha of the blood, shleshmanaha of the kapha. So the prasada bhaga means the essence of rakta dhatu. So Ayurveda says that there are 7 systems of body tissues. The second system of body tissues is rakta dhatu. Asrujaha, the prasada bhaga of raktam, and prasada bhaga of kapha. Kapha dosha, when these two are combined, so the prasada bhaga of raktam and prasada bhaga of kapha, when they are acted upon by Peetham or Peetham, so the Agni Mahabhuta, which is inherent in Pitta dosha, when that acts upon the prasada bhaga of Rakta Dhatu and Kapha dosha. And then he says, Vayushchapyanudhavati. And then when it is acted upon by Vata, Tatosyantrani jayante. It is as a result of this, the intestines are formed, the small intestine and large intestine are formed. It is Vata dosha that gives shape and form and shape to the intestines. And then the nature of cells that are present in the intestine, that is governed by Peetham. Then he says, Tataha asya antrani jayante. And then Gudam bastischa dehinaha. The word Gudam means the sigmoid colon. So the anus and rectum, this is known as Gudam. So here the the squamous epithelial cells of the this entire region of the anus and rectum, this has to be taken in Gudam here. And Gudam and Basti is the urinary bladder. So these visceral organs are formed through this process. So that is what he means Pachanam, performed by the Tejo Dhatu or Agni Mahabhuta, which is inherent in the Pitta dosha of the body. So this is how the intestines are formed. So when there is any abnormality in Dhyanavata that performs this function in the intrauterine life, so some birth defect occurs. So this is studied under the heading of teratology in modern medicine. So whole of this teratology is from the viewpoint of Ayurveda. So it is purely Dhyanavata that is responsible for all conditions that are being studied under teratology in modern science. And then Tejaha enam pachati. And then Apaha kledayanti. So all the Jalabhava which we have in the Shariram, so this is purely because of Jalamahabhuta, which is inherent in Kapha dosha. And then Prithvi Samhanti. All the cellular factors, the molecular factors and structural factors that contribute to the development of the embryo. So all of these are governed by Prithvi Mahabhuta. And then he says, Akasham Vibardhayati. The Akasham Mahabhuta helps in the growth of the fetus. So this is about the intrauterine life. And even after the birth of the baby, the 5 Mahabhutas through the 3 doshas, they perform these functions. So the baby's growth keeps taking place. So there, the Akasha Mahabhuta, the proper function of Akasha Mahabhuta is there. And then, all the structures, all the cells and tissues that grow. So for them, the structural basis is offered by Prithvi Mahabhuta, which is inherent in Kapha dosha. So even after the birth, so this is there till the end of the life. So the function of the 5 Mahabhutas, which the Acharya has explained here, it is not, doesn't take place only in the intrauterine life alone. So it takes place even after birth, during the childhood, during the teenagers, the adult or the adolescent ages, adulthood, and even in the old age. These functions of the five Mahabhutas keep taking place constantly. So this is very, very important. So it is the three Maha doshas, Vata, Pitta, Kapha, that are responsible for health and disease. And Ayurveda says that in different parts of life and in different phases of life, the three doshas have a dominance. So there is a shloka in Ashtanga Hridayam of Vagbhatacharya. So he says, Vayoho Ratri Bhuktanam Tentamabhyadiga Kramat. The word Vayaha means age or lifetime. Vayaha. Ahan means daytime. Ratri is nighttime. Bhukta is food. So but the word Vayaha alone is relevant to our topic of discussion. So let me not go to the other things. Daytime. So how the doshas vary, during the daytime and nighttime. So the nocturnal and diurnal variation of the doshas within the body, that I'm not explaining now. And then at the time of eating food, during digestion and after digestion, so how the doshas are formed and which phase which dosha is dominant. So that is a totally different thing, and that I'm not explaining now. So he says Vayaha. So with reference to Vayaha or life, the lifetime of a human being. So Anta Madhya Adigaha. So Vata Pitta Kaphas. So they manifest themselves as dominant in the Anta. So Vata dosha manifests itself as the dominant dosha during the old age of a person. And then Pitta dosha manifests itself as the dominant dosha within the body during the middle age of a person. During childhood and adolescence, Kapha dosha manifests itself as the dominant dosha within the body. So for all of us, so when we are, when we were children, so when we were infants, toddlers, young children, and then adolescents and young adults, so until the age of 25, so it was Kapha dosha that was that was dominant in our body. And then once we cross the age of 25, up to 50 and up to the age of 50, Pitta dosha is the dominant dosha. After 50, it is Vata dosha which is dominant. So for children, it is Kapha dosha which is dominant. So only when Kapha dosha is there in abundance, a healthy growth occurs. So there is one example I would like to give. So children run and play. They keep falling many times. Even if they fall, nothing happens to them. So that is because the bones are very strong in them. The bone mineral density, the flexibility of the bone. So in Ayurveda, we call this as snigdhata of the bone. So all of this, the micro structure of the bones are very, very strong. So even if a child falls and all that, nothing happens to it. So what will happen? If a person in his 60s or 70s have a fall like that, see, immediately he gets fractured. So even without a fall, we see many people are getting fractures. So they'll be sitting on a cot or anything by resting their head on their hand. Then they'll be casually sitting, watching TV or doing something. They'll be casually sitting like that. All of a sudden, they'll develop fracture in their wrist. All of a sudden, the wrist bone will the bone below the wrist, they'll have a fracture here in the radius and all now. And then sometimes some old people, they'll just be standing normally. All of a sudden, they will develop fracture in the leg. So why does this happen? So it's because the bone mineral density has reduced. So we say in Ayurveda, we call this as Rukshata of the bone has increased. So we call this as osteoporosis, a condition known as osteoporosis, which is very common in elderly people. So, it's because of that, many older people, where people in 70s, 80s and 90s, so even when they don't do any physical activity, even when they are simply standing or sitting, all of a sudden they develop fracture. This is known as osteoporotic fracture or fragility fracture. So that is because Vata in the old age has increased. So Ruksha is a property of Vata. So there is excess Ruksha Guna within the bones of an elderly person. So as a result of that, he or she develops osteoporosis. And because of osteoporosis, he or she may develop osteoporotic fractures. Whereas children have excess of snigdhata within their bones. Snigdha Guna is the property of Kapha. So because of Snigdha Guna, even if a child keeps falling over and over again while playing, so he or she may never develop fractures. So this is all because of the doshas that are there in our body at different ages. So, the doshas will vary as we change. So, many age-related changes occur in the body. So, all these age-related changes are governed by the three doshas, Vata, Pitta, Kapha. So this is all about the basics. The basics of the three doshas with reference to children. And I would like to talk about a few commonly occurring problems in children and how to overcome that. So, for example, child asthma is a common problem that occurs in children. And then conditions like chronic obstructive pulmonary disease. So these are certain conditions that are commonly found in children. And in Ayurveda, we have excellent treatments to offer for such children. So we have good medicines which have no side effects and all that. And then there are problems like digestive problems like lactose intolerance. So this is also a very common problem these days. So when the Jatharagni, when it doesn't have the enough strength to digest the sugar within the milk and milk product, so it results in lactose intolerance. So this is another clinical condition which has excellent results in Ayurvedic treatments. And apart from that, so there are a lot of Ayurvedic regimens that could be followed for children to have healthy lifestyle, to have a healthy life. For example, regular Abhyangam or oil massage for children. So doing that will be extremely helpful. So oil massage could be given with a simple sesame oil or with coconut oil. For children who are prone to getting cold, cough, fevers and allergies, coconut oil is preferred because when we compare coconut oil versus sesame oil is little colder in potency. We call it as Shita Viryam. Viryam means potency. So there are two kinds of potency which Ayurveda says. One is Shita Viryam and another one is Ushna Viryam. So comparatively, sesame oil is of Shita Viryam, whereas coconut oil is of Ushna Viryam. So that is the reason, when we go to places like Kerala, people know the use of coconut oil is very common there, both for internal usage in daily cooking, as well as for external oil massage. People take coconut oil there in Kerala. So during the monsoons and during the winters, so when people take oil massage or abhyandam with coconut oil, it helps them to overcome the excess cold that is generated by the harsh weather there. So because such conditions, coconut oil is helpful. And there are very good oils in Ayurveda like Lakshadi Thailam, which could be used for children for healthy growth. For babies, this Lakshadi Thailam could be used. So it will help in the growth and development of all organs, the bones, the muscles and all that. And then we have oils like Dhanvantara Thailam, Ksheerabala Thailam, some simple Thailams, which were when used for children of all ages. So, it will help in the neurodevelopment. So it is very good for the normal milestone of a child. And when regularly Ayurvedic massage is done for a child, later on in his life, he or she may not develop diseases like osteoarthritis, cervical and lumbar spondylosis, and all other problems of the spine. So all of these could be prevented, or the incidence of the intensity of these conditions could be reduced. When children are encouraged to take oil massages from a very early age. So that is why Acharyas say Abhyangam Acharayat Nityam. Abhyangam has to be observed at all times. So this is something that has to be done like Nitya Karma Anushtanam. Ayurvedic practices like Abhyangam and then Gandusham. Gandusham is gargling. So there are certain oils when they are used from the right age. So just 1 week in 1 day in a week when certain Ayurvedic oils are used for gargling. So you just have to mix hot water, and specific there are oils like Arimeda Thailam or Arimeda Thailam. So when hot water is mixed with it and then gargled and then it is spit out, so it will take care of the oral health. So even after 60s and even after 60s and 70s, not a single tooth will fall when a person takes proper Gandusham as per the principles of Ayurveda from the right age. So this is very, very important. And then there is another simple procedure known as Svarna Prashanam in Ayurveda. So this is the Ayurvedic way of immunizing children. What is Svarna Prashanam? So Svarna Prashanam contains 2 words. So this is a compound word which contains 2 words, Svarnam and Prashanam. The word Svarnam means gold or gold bhasma. Prashanam means to consume orally. So there is a separate branch of Ayurveda known as Rasashastram. So in Rasashastram, many herbometallic and herbo-mineral medicines are prepared. So generally, when people hear the word heavy metal being used in medicine, they tend to get scared. Whereas in Ayurveda, one branch of Ayurveda known as Rasashastra, heavy metals like mercury, svarnam, silver, copper, lead, and tin are used. So by using these, these metals are not toxic to the body. So this is a separate branch known as Rasashastra. So there are 2 different schools of Ayurveda. So in one school of Ayurveda, only herbal medicines are used. And in this school of Ayurveda, more focus is given on external therapies like all the Panchakarma therapies, Abhyangam, Pirichil, Navarakiri, Shirodhara, Takradhara, and so on. Elakiri, Podikiri, Navarakiri, Navarateip, Talapodichil, and all these procedures. So in Kerala school of Ayurveda, the purely herbal medicines alone are practiced. So they don't use a single rasa medicine or herbometallic medicines. Whereas in Rasashastra, so they use bhasmas prepared from mercury, from gold, silver. So these bhasmas, these heavy metals like gold, silver, copper, and all that, they are subjected to a lot of purificatory procedures that are unique only to Ayurveda. So there are many different procedures like Ashtasamskarams for Parada, Ashtadasha Samskarams of Parada. So the word Parada means mercury. So it has many different elaborate procedures, and those procedures are extremely difficult to perform. And there are even today there are very few people in India, Vaidyas in India who manufacture these medicines strictly according to the rules laid down in the Shastras. So there are many procedures like Shodhanam, Maranam, Amritikaranam, and so on. So when these metals are subjected to these procedures, and then when they are converted into medicines, so they'll be mixed with a lot of herbs and other metals, minerals, and all that. So when proper procedures are followed and then these medicines are prepared, they don't produce any side effects at all. Whereas when no, when someone manufactures these medicines carelessly, so they may result in serious complications. But there are good companies in Ayurveda today who don't perform even a single mistake while preparing these medicines, and these are completely safe to consume. So Swarna Bhasma is taken in an extremely small quantities. And then, so how is this gold administered to the child? So this Swarna Bhasma is mixed with ghee, it is mixed with honey, and then it is mixed with herbs like Bacha, Brahmi, Shankhapushpi and others. So again, ghee and honey, the honey is all the honey that is available to us, it's not considered as honey. So this is not pure honey. So when pure honey and ghee have to be mixed, and once again while mixing, these are mixed in unequal proportions. Either the ghee should be taken in larger quantity, in a higher quantity than honey, or honey has to be taken in a higher quantity than the ghee. So why this is done? So in Ayurveda, our Acharyas have explained a concept known as Viruddhahara. So the word Viruddha means incompatible. So there are many different kinds of Viruddhahara. So there is a Rasa Viruddha. For example, the word Rasa means taste. So the loose translation of the word Rasa is taste. So when milk is combined with any fruit which has amla rasa, or not just fruit, any substance which has amla rasa or sour taste, so it is citric fruits, so it becomes Viruddha. So what happens when you squeeze lemon into milk? Tirinju pogu. So in the same way, so this is known as Rasa Viruddhata. So by taste, so the Madhura Rasa, the milk is when mixed with citric fruit, milk turns into a poison. Milk becomes a toxin. So that is the reason substances like paneer are very bad for health. So as per Ayurveda, paneer is a viruddhaharam. So eating paneer is a very, very bad habit. And then there is virya viruddha. So the word virya means potency, hot or cold potency. So when curd is mixed with a hot substance, it becomes virya viruddha. So commonly, curd should never be mixed with hot rice and then taken. So that is virya viruddha. And then honey should never be heated. So when honey is heated, it becomes a viruddhahara. And then when honey is mixed with any hot substance and then taken, honey becomes a viruddhahara. So this we call it as virya viruddha. And then there is something known as matra viruddha. The word matra means quantity. So anything that is incompatible by quantity is known as matra viruddha. So ghee and honey, when they are taken in, when they are mixed in equal quantities and then taken internally, so it is toxic to the health. So it becomes a toxin and it is very bad for health. So that is the reason when ghee and honey are taken in unequal quantities, so it is good for health. So Swarna Bhasma, again, ghee either for ordinary, normal children who, who are healthy, who don't have any health issues. So this is the normal prescription we give for Swarna Prashana. So there may be children who have respiratory problems like asthma, some children who may have allergies. So for them, what we do is we change the ghritam or the ghee. So there are innumerable ghees we use in Ayurveda. So just like how we have many different formulations like kashayams, asavas, arishtams, and then churnams, lehyams. So in the same way, ghrithams or medicated ghee is another very important group of yogas in Ayurveda. The word yoga means formulation in Ayurveda. So Ayurveda, the ghee which we prepare in Ayurveda, so it usually has two components. So one component is known as kashaya bhaga or kashayam component, The other one is known as Kalka Bhaga. The word Kashayam is, so certain herbs, the indicated herbs, so they are taken in the indicated quantities. They are boiled in water to extract the kashayam, and then it is filtered and the kashayam is taken. So this is the first component. The second component is kalkam. So any thick paste is known as kalkam. So we call it as togel in Tamil. So certain herbs, what we do is we take them as we grind them and then we keep them mixed together. So this is known as kalka bhagam or kalka component. So the component 1 and component 2 are processed in ghee or ghritam. So again, kalkam we make it into a fine paste, and then only then we take it for the preparation of ghritam. So again, in each ghritam, the preparation process differs. So there are hundreds of ghees we use in Ayurveda. We have ghees like Vidaryadi ghritam, Saraswata ghritam, Tiktaka ghritam, Mahatiktaka ghritam, Kalyanaka ghritam, Mahakalyanaka ghritam, Chatushpuvalaya ghritam, Brahmi ghritam. So we have hundreds and hundreds of ghrithams we use in Ayurveda. So for children who suffer from conditions like respiratory problems, we use ghrithams like Indukantam ghritam. And there are children who may have neurodevelopmental delays, children having cerebral palsy. For such children, the ghritam may vary. And there are some children who may have certain digestion issues. For them, we may give ghrithams like Saraswata ghritam. And then, there may be children having autism, conditions like ADHD, that is attention deficit hyperactivity disorder, ADHD. So attention deficit, they will have no proper attention at all. So when when the parents give when they have to give command 25 times or 30 times, when they keep repeating the same command over and over again, they'll be able to grasp it once and then respond. So that is a deficit of attention. And then they'll be hyperactive. It will be very difficult to control them. And then, so this is for such kind of children, we have different ghrithams like Mahapaishachaka ghritam. So there are many different ghrithams we use. And then Panchagavya ghritam, Mahapanchagavya ghritam for children suffering from conditions like autism and all that. So the ghee varies from, it may vary from child to child. And then the usage of herbs like Vacha, Brahmi, Shankhapushpi. So even there may be certain changes. So all as per the clinical judgment of a Vaidya. So how does Varnaprashanam benefit child's health? So it enhances the natural process of Dhatu Vriddhi. The word Dhatu means system of body tissues. So the 7 systems of body tissues, so it enhances the natural process of Dhatu Vriddhi. Rasa Dhatu is the first Dhatu that is formed after the food we eat undergoes transformation. Rakta Dhatu is the second system of Dhatu. Mamsa Dhatu, so the muscles all comes under Mamsa Dhatu. Medo Dhatu is the adipose tissue, fat, cholesterol and all that comes under Medo Dhatu. All the bones and cartilages come under Asthi Dhatu. Bone marrow and brain come under Majja Dhatu. And Shukram is the reproductive Dhatu both in men and women. So Swarnaprashanam acts upon the 3 doshas of the body, and by acting upon the 3 doshas, it modulates Dhatu Vriddhi efficiently. And Swarnaprashanam promotes overall growth in a natural way. And because it has many, a lot of benefits, it is not just useful for normal healthy children. So that is the reason it is also very, very essential for children with special needs like autism, learning difficulties, ADHD, as I told you, and then delayed milestones, and even for children with conditions like cerebral palsy. So we call this as Thakaroga in Ayurveda. So Acharya there is a treatise known as Kashyapa Samhita. So there Acharya says, Balaha Samvatsara Apannaha. So even after the age of 1, Padabhyam Yonagachati A child who cannot walk by himself by his foot, so he is known as no Phakka, child with Phakka Roga. It's Phakka, Phakka. So conditions like neurodevelopmental delays. So these could be grouped under Phakka Roga. And then the conditions like cerebral palsy could also be grouped under the larger umbrella of Phakka Roga described in Kashyapa Samhita. So I would like to share some historical insight with reference to this Varna Prashanam and the practice of pediatrics in Ayurveda. So the branch of Ayurveda has got 8 branches, and among these 8 branches, one branch is known as Kaumara Bhrityam. The word Bhrityam means care or offering service. Kaumara is person in his childhood age is Kaumara. So care for children is Kaumara Bhrityam. So the practice of pediatrics is known as Kaumara Bhrityam. Kashyapa Maharshi is someone who all of us know. So it was this Kashyapa Maharshi who wrote a treatise known as Kashyapa Samhita. So initially he was a very young boy who was not even 10 years old. He was an extremely great scholar in Ayurveda. And he was extremely, he was a very great expert in treating all the, in practicing all the branches of Ayurveda. So once he went to an assembly of rishis who were, very advanced in age. So all of them were very great scholars in Ayurveda. So when he wanted to present something, so the sages, all the Maharshis laughed at him, saying he's a very small, so he's just a young child. And he's not competent to present something on Ayurveda. He's not competent to treat patients. So he said only an old person is competent of teaching the science of Ayurveda and then handling patients. So immediately he performed tapas and he transformed himself into a very old person. So, and he was not Vruddha Jivaka. So when he attained the body of a very old person, so then the Maharshis accepted him. So and it was then he wrote Kashyapa Samhita or Vruddha Jivaka Tantram. And in this Kashyapa Samhita, the oral administration of Svarna Bhasma has been explained. So he says, Suvarna Prashanam Hyatat Medhagni Balavardhanam Ayushyam Mangalam Punyam Vrishyam Varnyam Grahapaham. This process known as Suvarna Prashanam, the word Suvarna means Svarna. Prashanam means to consume orally. It increases Medha, cognitive abilities. Agni, the central digestive fire, and the manifestation of this digestive fire within the digestive tract, the 5 Bhutagnis, and the manifestation of this central digestive fire in the 7 system of Dhatus known as Dhatuvagnis. So it enhances the strength of all the 13 Agnis within the body. It enhances Balam. So Balam is good immunity, physical strength. All of these, the word Balam could be interpreted in many different ways. The good buildup of muscles and bones, that could be considered as Balam. Good immunity could be considered as Balam. And Ayushyam, the word Ayushyam, something that is good for Ayush or the lifespan. So something that enhances lifespan is Ayushyam. Mangalam is something that is auspicious. And then Punyam, and then Vrishyam, the word Vrishyam it is very good for the sexual health in the future, the later on in life. And Varnyam, the word Varnyam is it enhances complexion. Grahapaham, so it wards off the evil effects of the grahas. So this Varna Prashanam is generally given in Pusa Nakshatram, is known in Sanskrit, it is known as Pushya Nakshatram. So the Pushya Nakshatram of every month, so that is the time Swarna Prashanam is administered. So it is administered on the empty stomach early in the morning. And for healthy children, so 21 consecutive Pushya Nakshatras, the Swarna Prashanam is administered. And children who have different health problems, So the duration of Swarna Prashanam will vary. For some children may require Swarna Prashanam for 1 month continuous, so that is 30 days continuously. Some may require Swarna Prashanam for 2 months, some for 6 months, some for 1 year. So whatever be the case, it may begin with on a day which has Pushya Nakshatra. So because to buy gold, for people who collect gold from mines and all that, people who manufacture gold and jewelry, and people who manufacture prepare medicines from gold, any medicine that has to do with Swarna Bhasma. And then when any medicine is having Swarna Bhasma, so is administered, to start it, Pushya Nakshatram is very good. So that is the reason Pushya Nakshatram is generally considered. So this is as per Jyotisha Shastra. So generally it is given on 21 consecutive Pushya Nakshatrams, or for 1 month continuously on all 30 days, or 6 months or 12 months, as per the condition of each child. So that will be decided by a Vaidya. And after giving on the days when Swarna Prashanam is administered, junk foods, giving junk foods to the children should be avoided. And the minimum age could be as young as 6 month or 1 year old child. They can be given Swarna Prashanam. And the maximum age for Swarna Prashanam is 15 to 16 years. Because by the time boy or girl reaches 15 or 16, all the dhatu, the formation of all dhatus would have been finished. So the dhatus accepting the medicines of Swarna Prashanam, so that may not be there. So that is so the earlier Swarna Prashanam is started, the better results will be there for the child. So this is all about Swarna Prashanam. So this is all about Ayurveda for children. So with this I would conclude. Any questions? Any questions?
Namaskar. This is Anandi.
Yeah.
I know for many children here, eczema seems to be a problem, really dry skin.
Yeah.
And oil massage is not practiced at all, I should say. So what is a remedy that can be, based on Ayurveda that can be
First
easily
it has to be ascertained whether it is eczema or psoriasis.
Okay.
So as per Ayurveda, we say, we examine if the skin lesions have Sravata or absence of Sravata is there. Presence and absence of Sravata is something we look for. So oozing out of any fluid is known as Srava. So when there is no Sravata and it's pure dryness, then oils could be used. If there is any Srava, any fluid oozing out, we strictly don't use oils. Any kind of oil is contraindicated there.
Okay. Yeah, I don't think there is any oozing out of liquids yet. It's children or youngs.
Okay.
Still.
Okay. So I mean, there are certain procedures like Kashaya Dhara and Takra Dhara. So these are external therapies. So I mean, we'll have to see the patient in person, then examine the skin properly. And then, certain internal medications have to be given. Then, external therapies like Takradhara, Kashayadhara, and then Raktamokshanam. So, all of these have to be performed after assessing the patient.
Noted. Thank you.
Yeah.
I see somebody has asked a question in the chat, I think Lakshmi. So, she wants to know a reference point for items that can result in viriums. You were talking about some of them when they are consumed. So she wants to know what are those items, as well as what would be a general guide for food intake, the quantities.
General intake. So the virium, so foods with Ushna virium, foods with Shita virium. So it varies from season to season and from person to person. So there are some people who may have Ushnata within their body. Some people may have Shitata naturally within their body. So for such people, foods and liquids, when someone who has excess ushnata in the body, for such a person, no substances, solids and liquids that have Shita Viryam, so those are encouraged. For a person who has Shita Viryam, excess Shita Viryam within the, in the internal environment, then foods and liquids that are of Ushna Viryam, so these are advocated. So when we say Ushna Viryam, so it could be, items like Jeerakam and Maricham, Melaga. And then, when we say Ushna, when any Shita Viryam, foodstuffs and then liquids. So taking a lot of tender coconut, taking butter, taking ghee is excess Shitam in nature. And then taking fruits like watermelon and all that is Shitam in nature. So this is just a general explanation for it. And it also differs from the climate, the weather, So all of this is there when taking Shita Viryam foods and liquids, Ushna Viryam foods and liquids. All this is.
Yeah, I was. This is Lakshmi.
Yeah.
I was also requesting, if you have any general, guideline, reference book or something, because you mentioned honey should not be taken as is, equal quantities of certain things don't work. So, is there a general guidebook, something that we can kind of buy and keep so we can refer?
Guidebooks? No, I mean you can buy. Have you heard of David Frawley? I mean his books are very good.
Okay. Last name, Minnesota?
David
Sorry?
Frawley.
Frawley. Okay.
Yeah.
Okay. I will try to find that.
And then if it is Tamil, there are some olden books which are not available. No? Have you heard of Dr. Radhakrishna Shastriman who lived in Srirangam? He passed away some 8 years ago in 2014 November. He passed away. He had written a series of articles and books. So I mean his books and articles could be taken as reference. So but all of those are in Tamil.
I see. Okay. Okay. I will try to find that. Yeah.
Ram.
Yeah.
Is there any specific reason they say, right, don't eat nellika, gooseberry or kira in the night? Anything
Because
specific?
kira is extremely heavy to digest. It is also Shita Viryam in nature and it is also heavy to digest. So that is the reason kira is not recommended for intake in night. The same way, nellika is also Shita Viryam. So generally all substances which have amla rasa, that is sour taste, they are Ushna Viryam in nature. So there are two exceptions for this. So Acharya and Acharya says in Ashtanga Hridayam, Prayomlam Pitta Jananam. So any substance that is sour in nature, in taste, so it tends to increase Pitam because it is of Ushna Viryam. Any Amla Dravyam or sour substances, it is of Ushna Viryam in nature and it tends to increase Pitam. And there are two exceptions to this. Dadima Amalakadrate. Dadimam is pomegranate. Amalakam is Nellika. So Nellika and pomegranate, these although they are of Amla Rasa, they have Shita Viryam. So that is the reason Nellika is not recommended in night. So it tends to increase Shitam. So people having sinusitis, people having respiratory problems, especially for them, it is not advocated. Whereas for people who have acid peptic disorders, there is nothing wrong in it. And people who have Ushna Shariram, if they take Nellika in the night, it won't harm them much.
Okay. You said that kira is very heavy to digest, especially in the night.
Yeah.
But when somebody is having constipation, they always recommend eat lot of greens, which is kira, right? So it is kind of a laxative, right? Like banana.
No, but kira, other kira, although maybe laxative tends to depress the Agni. So kira is not recommended. So instead, Triphala could be taken. So, so for some people, Nellika is not advocated for oral consumption in the night. Whereas for some people, we advocate oral intake of Nellika in the night. So for the best example is Triphala. So when Triphala is consumed in the night, so the Aushadha Kalam which Acharya says for it, Triphala Madhutarpirbhyam Nishi Netrabalaya cha, says Acharya. So Triphala has to be taken along with Madhu and Sarpis. Madhu is honey, Sarpis is ghee. So ghee and honey in unequal quantities. They have to be mixed, and then Triphala is mixed with it, and then taken internally during the night time. So when it is taken, it helps to enhance the health of the eye. So it is very good for all the ocular tissues. So in that way, Nellika is indicated during the night. And for patients who have diabetes, so there is some churnam known as Nishamalaki churnam. Nisha means a meaning Nishaka. So the word night is Nisha. And Haridra or Manjal. So turmeric is also known as Nisha. So in among herbs, so when we say Nisha, in Ayurveda, it means turmeric. So turmeric and gooseberry. So the turmeric powder and gooseberry powder, these are mixed and taken internally. So for diabetic patients, it is very good. So we advocate for a lot of diabetic patients. For some people, it is advocated. For some, it is not advocated. Taking Nellika in the night.
Okay, thank you.
Does anyone else have any questions? Otherwise, we can thank Dr. Gokul for a wonderful session again. Very, very informative. We learned a lot today. The best takeaway probably is paneer is not healthy. Paneer that is very popular these days is certainly not very healthy according to Ayurveda. So we have learned a lot. So it will all be uploaded soon. So we can go back and use it as a reference. Thank you so much, Dr. Gokul. It was
Thank you.
very,
Yeah, we'll finish it with Mangala Charana Shloka.
Sure.
Yeah. Raga Dhirogan Satata Nushatta Nasheshaka Yatra Srita Nasheshan Autsukya Moharatidan Jaghana Yopurva Vaidyaya Namostu Tasmai. Okay, thank you.